If you've been told you have macular degeneration, one of the first questions you'll probably ask is whether it's the dry type or the wet type. Although they share a similar name, they're actually quite different conditions, and the treatment options are very different too. So what is the macula? Well, the macula is the small central part of the retina responsible for your sharpest vision. It's the part that allows you to read, recognize faces, drive, and see fine details. As we get older, changes can occur in the macula. These changes are known as age-related macular degeneration. Dry macular degeneration is by far the most common form, affecting 85 to 90% of people who have macular degeneration. Over time, waste products, often called drusen, build up beneath the retina. The light-sensitive cells gradually become less healthy and the central vision slowly declines. Most people notice that reading becomes more difficult, colors may seem less vibrant, and they need a brighter light to function. Dry macular degeneration usually progresses slowly over many years. Wet macular degeneration, on the other hand, is quite different. Wet macular degeneration is less common, but it's much more serious because vision can deteriorate quite quickly. In wet macular degeneration, abnormal blood vessels grow beneath the retina. These fragile vessels leak fluid or blood, damaging the delicate retinal tissues. Patients often notice that straight lines suddenly appear bent or distorted, or that part of their central vision becomes blurred over days or weeks. So, treatment is where the biggest difference lies. Unfortunately, we don't have any treatment that can reverse dry macular degeneration, although certain vitamin supplements may help slow progression in selected patients, and several promising new treatments, including injections, are emerging. Wet macular degeneration, however, can often be treated very effectively with injections into the eye that stop these abnormal blood vessels from growing and leaking. So, when should you seek help? If you've been diagnosed with dry macular degeneration and you suddenly notice distortion, blurred central vision, or a rapid change in your sight, please don't assume it's simply getting worse. These symptoms could indicate that the dry form has converted to the wet form and that it needs urgent assessment. So, what's the overall take home? Well, dry macular degeneration usually progresses slowly, whereas wet macular degeneration is more urgent, but it's also the form we can often treat successfully if it's detected early. So if you have any concerns, it's worth seeing an eye professional to get your eye checked.